While South Africa over the last few decades has managed to drastically improve its treatment of HIV/AIDS as well as work on preventative measures, there's still much to be done. This morning we're in Soweto, where the Department of Health alongside the Minister was launching the 1.1 million antiretroviral therapy campaign. South Africa has 7.8 million people living with HIV/AIDS, with around 7.5 million of them knowing their status, and an estimated 5.9 million on antiretroviral treatment.
We are going to look for 1.1 million people who are known to be HIV positive but are not on treatment. Either they were, they've stopped, or they've never even started treatment. We are doing so because we want South Africans not to get used to the idea that there's a disease called HIV and AIDS, and it's there, and we are going to live with it, or we are going to live side by side with it. We don't want that, because that should not be. Excuse me. They must know that we must eliminate it. We might not eradicate it, but our aim is to eliminate it as a public health threat by 2030.
The initiative aims to use outreach to mobilize.
SANAC has galvanized all the SANACs within all the provinces to make sure that everybody hits the ground running to find the 1.1. The targets have been broken down to meet not just the 2025 targets, but also the 2028 targets for the National Strategic Plan for South Africa, by province, by district, and by facility, so that it's easier for them to find. Because the facilities know their patients. They know who is missing from care. And if they work with all the stakeholders, including the traditional leaders, the traditional healers, they'll be able to find them and bring them back onto care.
Men remain the missing population in the treatment.
Most of the people are looking for are men. That's the message which people also must know. We're looking for men, because out of this 1.1 million, the majority of those people are men. Women have done very well to help the fight against HIV. I must say, I want to repeat it many times, women must have done very, very well.
We are working with the civil society, the men's sector, under a campaign called A Better Man for Tomorrow, and the men are pushing this.
We are a supporting partner to the government, which is DOH. So what we do, we go out in the outreach programs, which is what you actually see now. We actually portraying what we do when we go to outreach programs. So as you just mentioned, men don't want to go to the main institutions because they will be stigmatized of some sort. So what we do, we take our mobile clinics, we go and provide them with our services, and we are also supporting specifically men's clinics.
This comes amidst much uncertainty in the sector, as the US President Donald Trump announced that all aid to South Africa will be suspended, also calling for a 90-day suspension of all US aid. But despite there being an exemption to some AIDS clinics and organizations, there's still uncertainty on how the programs will be funded going forward. However, new donors are being sourced.
Cannot afford at this time to turn back the tide on the progress we have made. And so we, together with our global partners, we are mobilizing everywhere we can. We are convening. We are basically saying the show must go on. We have to continue in the level of commitment we have. We have to get governments themselves, in addition to South Africa, all the other governments we work with, are putting their hands up and saying we are going to make sure that we fill in the gaps that have been created by this pause in aid from the US government.
The initiative aims at ensuring 1.1 million HIV patients are given treatment before the end of the year. Hasina Gori, SABC News, Johannesburg.